Hi, my name is Jessica Prall, and today I'm going to talk about the dangers of opioid drug prescriptions. Having worked in a pharmacy as a pharmacy technician for a while now, I have filled my share of prescriptions for opioid drugs. Having been developed to combat moderate to severe pain, these drugs are frequently prescribed by doctors for various surgeries and injuries that patients may experience throughout their lifetimes. However, there is a difference between using these prescriptions properly and abusing them. Often, when I receive a script from a patient, the doctor will write in the directions that the prescription must last so many days. This is due to the issue that patients will oftentimes abuse their scripts and run out of the pills before they are finished taking them. According to drugabuse.com, opiates are among the most abused drugs in the United States as they're easy to get a hold of, readily prescribed, and very addictive, a dangerous combination. Some examples of opium-based drugs include hydrocodone, oxycodone, fentanyl, morphine, and the illegal substance heroin. Today I'm going to talk to you all about the severe and common side effects of these medications, the abuse potential for opioid drugs, and the link between crime and opioid abuse. Opioid drugs have a laundry list of different side effects ranging in severity. According to WebMD, one of the reasons why your doctor needs to manage pain medications so closely is that they can potentially cause side effects, including constipation, drowsiness, nausea, and vomiting. According to drugabuse.com, side effects also include lethargy, paranoia, and respiratory depression. Also, according to drugabuse.com, the short-term effects of opiate use include feelings of euphoria, pain relief, drowsiness, and sedation. The long-term effects of opiate use include nausea and vomiting, abnormal distension and bloating, constipation, liver damage, brain damage due to hypoxia resulting from respiratory depression, development of tolerance, and dependence. Because of the intense high produced by the interaction of opiates in the brain, the drugs remain extremely addictive, sometimes causing measurable symptoms of addiction in under 3 days. The best known side effect of opiates is addiction, and it's surprisingly easy to become addicted without realizing it. This dependence on the opiate drugs causes addiction, which leads to the abuse potential for opiate drugs. Abuse potential in opioid addiction is easy to spot. Opiates also cause your irises to relax, creating pinprick or pinpoint pupils. This is one of the big giveaways of opiate abuse, and it's hard to disguise. According to Nancy Schutz's article citing the CDC, more than 2 million people in the U.S. either abused or were dependent on prescription opioid painkillers in 2013, and more than 16,000 people died of overdoses. Nora D. Volkow, a medical doctor, states, several factors are likely to have contributed to the severity of the current prescription drug abuse problem. They include drastic increases in the number of prescriptions written and dispensed, greater social acceptability for using medications for different purposes, and aggressive marketing by pharmaceutical companies. The increase in the number of scripts can be seen in this graph. The blue is the total number of prescriptions written, the red is hydrocodone prescriptions, and the green is oxycodone prescriptions. And as you can see, there's been a very drastic increase in the past several years. These factors together have helped create the broad environmental availability of prescription medications in general, and opioid analgesics in particular. This greater availability of opioid and other prescribed drugs has been accompanied by alarming increases in the negative consequences related to their abuse. For example, the estimated number of emergency department visits involving non-medical use of opioid analgesics increased from 144,600 in 2004 to 305,900 in 2008. Treatment admissions for primary abuse of opiates other than heroin increased from 1% of all admissions in 1997 to 5% in 2007. Overdose deaths due to prescription opioid pain relievers have more than tripled in the past 20 years, escalating from 16,651 deaths in the United States in 2010. After someone becomes addicted to opioid drugs, they are more likely to commit crimes. According to Morris Ploskow, for most narcotic addicts, Predatory crime, including larceny, shoplifting, sneak thievery, burglary, embezzlement, and robbery, is a necessary way of life. Drug addiction leads to predatory crime as a way of life due to the fact that narcotics on the street are extremely pricey. Almost without exception, addicts resort to theft to obtain money for the purchase of the drugs. The compulsion of the addiction itself, coupled with an astronomically high cost of the drug, leads to the addict inescapably to crime. For the addict, there is very simply no alternative. In today's culture, drug use is glorified in the pop culture through the music and lives of celebrities. Many people can become addicted to opiates very easily. Unfortunately, the short 3 days that it takes for your body to become dependent on the drug can turn someone's life around. Opiates are not a drug that should be handled lightly. The government regulates these drugs so harshly for a reason: their abuse potential. The painstakingly long process involved with dispensing these medications ensures that the patient gets exactly what the doctor prescribed and nothing more. This is an effort to preserve the drug and keep the use of the prescription medication for its intended use. I hope that because of this presentation, you will not only think before you take oxycodone in the future, even if for medicinal and legal use, but also before using any other habit-forming drug. The potential to develop severe side effects is there, and the dependence on these drugs is not something to be taken lightly. Thank you. This is Chris.
Hi.
My sister Taylor, and my dad, the cameraman, Rick.